Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 383,468 confirmed cases of COVID-19 in Canada and 118,199 cases in Ontario. Chatham-Kent has 512 cases and Sarnia-Lambton has reported 412 cases. Michigan now has 366,242 cases, with 20,615 cases being in Detroit. Today, we are reporting 41 new cases of COVID-19 in Windsor and Essex County. Of the 41 cases, 13 are close contacts of confirmed cases, 1 is community acquired, and 27 are still being investigated. We have had 3,740 cases since March. 3,248 cases are now resolved, and 410 cases are active and being followed by our health unit. 15 people are currently in the hospital and 2 people are in ICU. Unfortunately, we are reporting 2 deaths today. A gentleman in his 90s passed away in a long-term care home, and a female in her 80s and living in the community has passed away. We have lost 82 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 18 active outbreaks in Windsor and Essex County, 5 in long-term care and retirement homes, 7 workplaces are in outbreak, 2 schools are in outbreak, 2 community outbreaks are ongoing, and 2 hospital outbreaks. I wanted to provide an update on our flu vaccine distribution as we get questions about this as well. So to date, we have distributed nearly 114,000 doses to our healthcare partners in long-term care and retirement homes, hospitals, and healthcare providers. Pharmacies continue to get their flu vaccine directly from the government pharmacy, and we have 101 pharmacies providing flu shots in Windsor and Essex County. We can no longer order high-dose flu vaccine, but we understand some pharmacies do have some available. This vaccine specifically for those 65 years and older. 31,800 doses were distributed in our community, and that includes those residents in long-term care and retirement homes. Overall, in long-term care and retirement homes, we have supplied 8,000 doses of vaccine. So please continue to visit our website and wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I don't have any update. I think Teresa has provided her update. We'll be happy to take questions, Mike.
Okay, we'll start with questions from the media. Today we'll start with the Windsor Star.
Yes, Teresa, about the flu vaccine distribution, you said that you will no longer be receiving the high dose. Will you still be receiving the regular vaccine?
So we actually have approximately, I'm doing a quick math here, but we're allotted 127,000 doses every year. So we've distributed 114,000. So we still have vaccine doses in-house. Even though we don't have any high-dose vaccine available, we do have regular doses of vaccine that can be given to the general public, including people over 65.
Okay, that's everything for now. Thank you.
Okay.
Any questions from AM800?
I'm just wondering if there are any updates on Bagley. I know it was asked at the end of last week, early this week, just about how it's been the 2 weeks now. So you're still working with the school board and whatnot to try and get some classes back there?
So we have been working with the school board on a return to school plan. They are, they will be due to get out of isolation soon. So the plans are ongoing. We have another internal meeting today specifically about both of the schools that are currently in outbreak as their time in isolation is coming to an end.
Okay, thank you.
Any questions from CBC?
The provincial health minister said yesterday that the province will help our region. Are there any signs of that assistance coming?
So as we onboard the staff that they have provided to us, we hope to have a little bit of relief in the next week or two as these people, start helping us with the case and contact management piece. So we have been very open with the ministry, and they have been helping us all along. And so we will continue to access whatever they can provide with us, but we do want an opportunity to onboard the new staff and get them slotted into our ongoing operations. And we have internally reassigned some staff back to COVID and readjusted some manager oversight as well. So we hope that some of these measures will help, get us back on track with case and contact management.
Thank you. As we spoke about yesterday, additional restrictions and a potential lockdown. I'm wondering if it does come to that point, what actions the health unit is considering for the local level.
So, if I heard you correctly, you're asking what additional measures that we are considering on top of what we have right now. Is that your question?
If in lockdown.
Yes, sorry, I was a little bit unclear there.
Yeah. No, no, definitely. I think one of the key issue that we have to address is our unique challenges and what we are noticing in our community. And one of the key area of concern so far, especially with the school outbreak, is the school cases. And even though what we have found, most of these case exposures are happening outside of the school, other than the one that we have declared the school outbreak. But in any case, when you have more background cases in the community, it does pose risk inside the school system. So we are, that will be one area that we will be paying very close attention to, that how we can keep keep the schools safe. And also other unique challenge that we have is our border. Even though we have been talking about it, we have some specific messaging around that, but those would be the two areas of concerns. I think other than that, most of the high-risk settings are already have received directions and strict guidance in terms of their operations. So those would be the two areas that I would be paying close attention to.
Thank you.
Any questions from Blackbird?
Good morning. Just to clarify what Teresa was talking about, do you think that it'll take about a week before we'll see some kind of, difference with the new staff that are coming on board to get caught up? Is that your estimation?
I am optimistic that a week is enough time. We are getting quite a bit of support with the contact tracing part of it. So that's kind of separate from the actual cases. So I think there's a lot more support that can readily be available for the contact part of it. The case management, as I said, we are reassigning staff. So a week might be optimistic. I think we'll see improvements in our ability to reach out in a more timely manner. It is taking us a few days now to reach people with cases because of our cases being so high. So with more staff in the next, week to 10 days maybe, we should have a better handle on it again.
And I guess just to Dr. Watts' point that he made on Monday, then it is really important that people are checking their own results and not waiting to hear from the health unit and to kind of put themselves in isolation once they have those results, or even, continue their isolation once they have those results.
Definitely, and that has always been the message, to stay isolated pending your result. And then when you get your result and you can access it online, stay isolated, adhere to those those precautions until you hear from us and get more specific directions. But that is wise advice from our medical officer of health.
Thank you.
Any further questions from the Windsor Star?
Yes, to either of you. I know in the past that you've said that the cases that are still under investigation, once those investigations are complete, the information is updated on the WeChew website. You do have there more than 550 cases where the exposure type is unknown. Can you explain that? Why unknown and why not community transmission when you can't figure out where they contracted COVID?
So I'll try to answer that question, but generally speaking, it really depends on the language and terminology that how we are classifying this case. So community transmission means that truly that there is the missing link, and we have gone through all the possible scenarios, but still couldn't identify it. Versus unknown exposure, which would be that maybe there's a gap in information or there's a recall issue. So I think it's more of a technical term, and my epidemiologist can probably provide the clear distinction that why we're using one versus the other. Sometimes it's the classification that we use for reporting purposes. In other areas or jurisdiction, you may have heard non-epi-linked cases. So there are a number of terminologies that we use. I will try to connect why we are using one terminology versus the other, and can let you know tomorrow.
Okay, that would be great. Thank you.
Any further questions from AM 800?
Yeah, just to sort of go off of what Maureen was asking about the additional staff and how long it will take to get them on board and everything. You mentioned that sometimes it's taking you 2 to 3 days to get in touch with people, understanding obviously that it's a caseload issue. So if someone is asymptomatic and may not know that they came into contact with a confirmed positive case, how much extra risk is this adding to those people in the general public? If they're walking around asymptomatic, not knowing, meanwhile, unfortunately, it's taking you guys 2 to 3 days to get a hold of them to notify them.
Yeah, no, that is a risk. And if you go back to what our original message from the beginning is, we're trying to mitigate the risk right from the source when we are saying limit your number of close contact, limit your essential activities only, and even when you're out there, always maintain your physical distancing and wear the facial covering or mask. So in that, if people are strictly following that, we are mitigating a ton of risk there, because even if they're asymptomatic but positive, if they're not going outside, they're not putting anyone at risk. And then if they are going outside, if they're maintaining the physical distance and wearing the facial covering, they're still mitigating the risk. So that's why even though some of these measures that we recommend could sound as basic and trivial, but those are the measures that can still protect the people. And in the instance when your community case rates are high, it is a risk. And unless we have the ability to test everyone every day, we can't even say that, where the risk lies. But some of these broader public health measures are recommended and put in place just to mitigate that.
Okay, thank you.
Any further questions from CBC?
Do you have any concerns about a rush on testing just before the holidays from people who might want to get tested as a way to, clear their conscience before visiting with family members?
Well, I think anyone who has had a high-risk exposure, anyone who's identified as a close contact, anyone who has any kind of symptoms, I think they should definitely get tested, irrespective of the rush or the high capacity in the lab. I think those are the key people that we definitely want to target. But I don't want people to think and use the test as a tool to find ways to still do what they do. Because if that's the approach, I think that's the wrong approach, that I go out and I do everything and then I come back and go and get myself tested. And then if I'm negative, then I'm feeling better. I think that's the wrong approach. And it also may be inaccurate, because we know from the incubation period perspective. So even let's say if someone had a high risk exposure today, and even 3-4 days down the road, they go and get themselves tested, and if it's negative, they feel fine, they could still be infected, that their symptoms can start to show up 10, 11, even up to 14 days after their after their last exposure. So I do worry from that end, but anyone who had a high risk exposure, I'm not worried that they're going for testing, because I think this is the right thing to do. That's the only way we can identify the cases earlier and isolate them appropriately and prevent any further transmission.
I also wanted to ask about the provincial asymptomatic testing that's going on in schools in the GTA and Ottawa. Is something like that needed in Windsor-Essex?
I think that definitely we can benefit from that, knowing that our region has one of the highest case rates in the province, and there has been some preliminary conversation. We did talk about that, but there's a lot going on locally here, and we never really get the chance to talk to the province from that perspective. But locally, there's been a lot of efforts. Every time our team is connecting with the schools, we are doing a lot of work, and with the 2 school outbreak, our hospital partners really supported us in testing, and we're hoping that as we continue to deal with that, that should be available to our region too, so we can have a better understanding of some of these asymptomatic prevalence in this school setting, if at all.
Could I squeeze in one final question?
Sure, go ahead.
Is there any talk of expanding the testing criteria just in general?
So that's the...
So that... I'm sorry, go ahead.
No, you go ahead. You finish your question first.
I mean, so that, potentially asymptomatic people in the community could get tested, things like that.
Well, I think that question would be better directed to the ministry. There is almost like a working group, provincial working group, who's looking at the testing strategy. And so that testing strategy is driven by them. There's always a risk and pros and cons of any of the approach that we take. And I think that's why it's important to look at the picture from the bigger picture. And the risks of all these tests, the capacity, the system capacity, and then whether we have the capacity to deal with that or not. Even though when we have seen, I think right after Thanksgiving, when the lab capacity was overwhelmed, there was like almost more than 10,000 samples that were delayed, and then it just adds up every day. So it's a function of all of that. And even though the government is doing a lot in terms of supporting all these testing and all these initiatives, but we also have to think about our human resource capacity. There is only limited labs. There is only limited technicians, microbiologists who are doing all this work. So there's a limit to that as well. And we know even from locally, as much as we're seeing more cases, for some positions, there's not enough qualified people to do that work. So there is this balance too. But to your question on the testing piece, I think it would be better answered by the province. If we have unlimited resource, then I would say that, yep, test as many as possible. That would give us better understanding of what's happening in the community.
Any further questions from Blackburn?
No, thank you.
Okay, thank you, everyone.
Thank you.